All right, so I think we're going to go ahead and get started. Um, so we have Victoria Wink with Basin Pacific Insurance and Benefits. She's going to walk us through open enrollment. If some of you are aware, some of you may not be, there is a special open enrollment period due to the COVID-19 outbreak. So I will turn it over to her in a minute, but I just wanted to take a second and let everyone know that we are broadcasting this on Facebook Live. Again, if any of you have connection issues, we are on Facebook Live under the Chamber Facebook page. We'll be uploading this webinar to our website and to Facebook Live. If you want to view it later, it'll be on there. I did want to say a quick thank you to our sponsor, STCU. They've been incredibly gracious as we move this from a physical program to virtual. And just as an FYI, mark your calendars, we'll be having another webinar on Friday, April 3rd, which is this coming Friday. That'll be at 11 o'clock, and that will be with the Washington State Employment Security Department. They will go over assistance that is available to business owners and employees due to the COVID-19 outbreak. So with that, I'm going to turn it over to Victoria Wink. She's the Benefits Account Manager at Basin Pacific Insurance and Benefits. If you have any questions, throw them out in the webinar or on Facebook Live, and we will try our best to answer them. And just to give you a time frame, these are slated to last between 30 and 60 minutes. So there's going to be plenty of time for questions. And with that, I will go ahead and turn it over to you, Victoria.
Thank you. I just wanted to say thank you this morning for taking time to listen in. As Logan mentioned, my name is Victoria Wink with Basin Pacific Insurance and Benefits. I am a certified licensed broker with the Washington Healthplanfinder and have been since 2013. And today I just wanted to spend a few minutes talking about individual medical coverage options during this COVID-19 outbreak. The Washington Healthplanfinder is offering a special enrollment period for those who don't currently have medical coverage. We're also seeing many individuals with current coverage that are experiencing life-changing events that would qualify for them to enroll through the Washington Healthplanfinder as well. My screen's gonna work here. So first, we want to talk about who's eligible to apply for coverage through the Washington Healthplanfinder. You must be legally present in the United States. You must be a Washington State resident. You must not have current medical coverage, or you've lost coverage in the last 60 days, or you're going to be losing coverage. So how do we enroll in health insurance during this COVID-19 outbreak? There are two ways that you can access medical coverage now. The first is by utilizing the COVID-19 special enrollment period. This special enrollment period is going on now through April 8th. As of this morning, we have not heard if this will be extended or not. The special enrollment period is available to eligible individuals who do not currently have medical coverage. One note here is even though the special enrollment period is going through April 8th, it will be retroed to an April 1st effective date. The second way to access coverage is through a standard special enrollment period. A standard special enrollment period is available to individuals who have experienced certain life-changing events, things like getting married, having a baby, getting a divorce or a legal separation, or a loss of health insurance coverage. For the sake of today's webinar, and what most individuals are going to be experiencing for right now is the loss of health coverage. So that's kind of what we'll focus on the standard special enrollment period. A loss of health coverage may likely be due to being laid off, or maybe a reduction in hours and you're no longer eligible for benefits through your employer. So those are the two different enrollment periods that we're going to discuss today. An important note here is in regards to Washington Apple Health. This is the state's free or low-cost health insurance plan. It's formerly known as Medicaid. You can apply for Washington Apple Health coverage anytime throughout the year. And if you qualify, you will be enrolled immediately. So you don't need a special enrollment period to enroll in Washington Apple Health if you are eligible for that program. If any of these scenarios apply to you, you will want to apply for coverage. Applying for coverage doesn't mean that you have to enroll, but it will show you what you qualify for. So I strongly recommend that you at least apply and see what your options are if you're experiencing any of these different scenarios. So the big question is, how do I apply? The first thing you're going to want to do is visit wahealthplanfinder.org. You will want to create an account. Once you are on the website, you will click Apply Now, and then that'll take you to the account creation prompts. You will need to gather all of your household information before you can finish completing your application. What information do we need to apply? You're going to need to know your tax filing status for the 2019 and 2020 tax year, whether that's married filing jointly, married filing separately, single filing taxes, had a household, or maybe a tax dependent of someone's tax return. You're also going to need household information such as names, dates of birth, and social security numbers for all members in your household. A common question that we get is who is considered in our household, and that's going to be anyone that you claim on your taxes, even if they don't want to or need to apply for coverage. So if you have a child that's away from home at college, but you're still claiming them on your taxes, you're going to need to include that child on your application. Another example that we see is if you co-parent and per your parenting plan, you claim your child on your taxes every other tax year, that child or dependent would need to be on your application as well. You're also going to need income information for everyone on the application. That would include that child if they're at college and they're having, if they're working a part-time job, you will have to include their income. Unemployment income will also be accounted for. There is a section in the application to account for any unemployment income that you would get. An important note about income is that you will be accounting for your 2020 income. When the federal government audits your eligibility, they're going to be looking at your adjusted gross income on your 2020 taxes. We do understand that this can be hard to estimate, but there are tools in place to help make those adjustments mid-year, and it's another reason why it's encouraged that you seek the help of a broker. Other information you're going to need is any employer-sponsored health insurance information. And that would be group coverage that's offered to anybody on the application. This could be your spouse's insurance information if they have coverage available to them. You will need to know the cost of the employee-only coverage and information found on their ID card, such as the name of the carrier, the type of coverage it might be, and the effective date of coverage. Once you have all of this information, you're ready to apply. A few things to keep in mind when you're completing your application. Just because you've entered everyone in your household on the application doesn't mean they have to apply for coverage. You will want to select no when they ask, is this person applying for coverage or continuing existing coverage through the Washington Healthplanfinder? The application will ask this question for every member on the application. So if your spouse is currently covered under their employer's plan, you will include them on the application, but you will mark no that they're not seeking coverage at this time. Another thing to remember is the income that you enter will be your gross monthly income. This is the amount you receive before taxes and any other deductions. There is a section that will go through any deductions. And there's also an income calculator tool that's available to help you figure out your income information that you should be entering as well. Another thing to keep in mind is if you or your family members are offered insurance through an employer, this needs to be reported. Otherwise, you may receive a tax subsidy that you are not eligible for, and then you would be penalized when you file your 2020 taxes. After you've submitted your application, you will find out what program you qualify for, either a qualified health plan, a qualified health plan with tax credits, or the free or low cost coverage through the Washington Apple Health Plan. If you are applying for multiple members in your family, each member will have their own eligibility result. So for example, if you're applying for yourself and your 2 children, you may be eligible for a qualified health plan with tax credits, but your children might qualify for the Washington Apple Health Program. So next steps in enrolling in coverage. If you qualify for Washington Apple Health, you will need to select a Apple Health carrier. All of the carriers offer the same benefits. You may find that your provider prefers to work with one Apple Health carrier over another. You can change your Apple Health carrier at any point. So if you find out that your provider would rather work with one carrier versus the other, you can change that. And once you make that change would go into effect first of the month following the date that you made that change. You are also going to get information in the mail. You'll get a packet, and it's going to go over all of the carriers that offer Washington Apple Health and any value-added services that they might provide. And that's a time for you to read up on it and make any changes as well. You will also receive 2 ID cards. One will be a state services card, and the other is from the actual carrier that you choose. And you will need to present both of your ID cards when you're seeking services. If you do not select a Washington Apple Health carrier, the system will automatically generate one for you overnight. And again, then you can make changes to it if you wish in the future. I have also seen as well when the Healthplanfinder is inundated, like they are now, that it may automatically just enroll you in one of the carriers. You're enrolled, and then again, you can change that at any time. If you applied using the COVID-19 special enrollment period, you will need to contact the exchange or a broker to open up your shopping experience and to be able to pick a plan. So if you're using the COVID-19 special enrollment period and you have not had prior coverage, it is not going to open up the shopping experience for you until you contact either the exchange or a broker to have your plan selection open up for you. Once you've picked a plan, you will have to make your first month premium payment. There is the option to do it online, or you can have the carrier mail or email you a bill. Usually that comes in 5 to 7 days. You will need to make your first month premium before they complete the processing of your application. And then lastly, if you applied for coverage using a standard special enrollment period, they will ask you a series of questions at the end of your application to see if you're eligible to enroll. Based on your response, the shopping experience would then open, and it would allow you to select a plan. Once you've selected a plan, the carrier will reach out again, either by email or mail, and request payment. They're also going to request documentation of your qualifying event. So for this example, if you've lost medical coverage, you can supply a letter from your employer or your former employer stating that you were enrolled on their plan and you're no longer eligible and the date that you're losing coverage. You can supply a COBRA offer letter or a letter from your prior insurance carrier stating that your coverage has ended or will be ending. And then once they have received the special documents, the special documentation, as well as payment, they will finish processing your application and sending out ID cards for you. Another question that we see a lot is where I can get assistance in completing my application and selecting a plan. You can call the Washington Healthplanfinder. They have a customer support line. This number is available to you on every screen during the application process. However, due to this COVID-19 special enrollment period, they are experiencing longer than normal wait times. They also cannot advise you on a plan to select. So they can help you complete your application and make sure the information is correct and that you have the shopping experience open to you. But if you need advice on selecting a plan, you will want to contact a broker so they can discuss the different plan options. We do have some network issues here in Tri-Cities where one carrier may have a specific hospital in network and the other carrier does not. So it's really important, especially in the Tri-Cities area, that you are educated on those types of things. Another thing is that the individual plans are in-network only benefits. So there is no out-of-network on individual plans in Washington State. So it's really important that you're working with somebody that can advise you of those things and help you select the plan that is really going to fit your needs best. So that's the other option. You can contact a local broker. A broker can link to your application. They can make sure it's completed correctly. They can help you select a plan that best fits your needs. And then they can assist after the implementation of your application with things like billing issues, claims assistance, and updates to your application through the Washington Healthplanfinder during the year as you're experiencing different life-changing events. Another important note is that there is no cost to you to utilize the help of a broker. So it's strongly encouraged that you get in touch with somebody that can help you with that. It is a free service and they're really going to know the ins and outs of the plans that are available here in Tri-Cities. There is a blue ribbon along the top of each screen that has a customer support link, and this will show you the exchange customer service number, as well as a prompt to find a local broker in your area. It allows you to search for a broker using their last name if you have someone in particular that you want to use. You can also enter in a zip code, and it's going to pull up any certified brokers in that area that can help you. It is going to show the broker's name, a phone number, an email address, and then a physical address as well. You're also going to see a navigator. There is a navigator option. The navigators can help you with your application, but again, just like customer support, they cannot help you select a plan. They can educate you on Washington Apple Health and have you complete the application, but they cannot advise on a plan. The last way to seek help would be to utilize the link under your dashboard. There is a quick links tab with a link to request help directly from a broker. And then that broker that you select, it would automatically send them a request for help and allow them to link to your application. A broker is not notified of your request, so I do suggest that you reach out to them by phone or email and let them know that you've requested help so that they know that they can help you with that. And then I just wanted to put together a couple of slides to help navigate your way through the Washington Healthplanfinder. This is the homepage that you will see when you go to wahealthplanfinder.org. The orange arrow here shows the Apply Now button that you're looking for to begin the process of the application. Once you click the Apply Now button, it's going to take you to this screen here. You will need to scroll to the very bottom of this screen. This screen is just going to show you the different ways that you can apply right now and kind of answer some quick questions that you may have before you begin the application process. So you will scroll all the way down to the bottom here, and then there's another Apply Now link that you will click. And then this link will take you to the Create an Account page. This can be the most cumbersome part of the whole application process. The username and password criteria is very strict since you are housing personal information here, like social security numbers, dates of birth, income information. So they have put in strong password and username criteria in order to protect that information. When you go through the application, it's also going to ask you some personal privacy questions, such as maybe you opened up a car loan in 2011. They're going to ask you, out of these 4 choices, which company was it that you opened that car loan? And that's just to confirm your identity and make sure you are who you are. We have seen for maybe the younger folks that don't have credit cards or haven't opened a loan or something like that, they might not have personal questions to ask you. In that situation, you are going to need to contact either a broker or the exchange and verify your identity so that you can move forward in the account application process. And then the last slide that I wanted to show you here was once you've created the account, and this is going to bring you to your dashboard or your home screen. So this is the screen that you will see every time you log into the Washington Health Plan Finder. Over on the left-hand side, you'll see under the Quick Links tab, mine says complete my application only because my example had an application in process. Yours there will say start my application. You will click that link to start your application, and it will take you through the prompts and then allow you to e-sign at the end. Under that link too, you'll see that Manage My Broker. And that's the link that we discussed in the beginning where you can find and search for a broker in your area. You can link up to them. You can request help from them. Your application will automatically be tied to their dashboard. But again, I would also reach out to them by phone or email and let them know that you've done that, because they do not get notified unless they log into their own Washington Health Plan Finder dashboard. So I really just wanted to give a brief overview to get started. We really like to do specific, individualized sit-downs or one-on-ones with each client, because we do really see that everybody's situations are different, and what might be an issue or a concern for one individual may not be for the other person. So I really wanted to keep it very brief here. But I do want to take a little bit of time and answer any questions that may have come in. I'm not sure if we received anything on Facebook Live.
It doesn't look like we have anything on Facebook, and haven't received any on Zoom. So I think I did have a question for you.
Yes.
Do you think, I mean, you and I kind of talked about this before the webinar, everything's kind of changing so quickly. Do you think the state will extend the open enrollment period at all?
We haven't heard that yet, but with Trump announcing his kind of shelter in place, stay in place, extending through April 30th, I would not be surprised if they do extend it. At this point, they have not. So that deadline is April 8th.
Okay. And then for people who might be in the event somebody does get laid off or their employer comes to them and lets them know they're going to be furloughed or laid off or placed on standby, if that date is after April 8th, can they still apply for coverage now so that they don't lose out on the opportunity? Or do they have to wait until they're actually out of work?
So the COVID-19 special enrollment period is open only for those that don't currently have insurance. If you find out that you are going to be laid off or furloughed or a reduction in hours, that's going to be the standard special enrollment period. So as soon as you find that out is when you would want to go online and apply. That also, when you use the standard special enrollment period, it allows you to enroll in a plan so that there's no lapse in coverage. So if you found out on April 3rd that you're no longer going to have benefits and you get on, your benefits through your employer should run through the end of April, you would then be able to get onto an individual plan starting May 1st.
Okay, perfect. Well, I think if you don't have anything else to add, I think we'll go ahead and end it there. For those of you who are on Zoom and Facebook Live, just a reminder, this coming Friday, April 3rd, we'll have Rebecca Williamson with Employment Security Department going over resources and assistance that are available through the state during the outbreak. That includes unemployment insurance and paid family leave applications and all of the assistance that are now available due to the outbreak that typically aren't available to employees and employers. So I just want to say thank you to Victoria for your time today. Thank you to STCU for the partnership and assisting with this program. And thank you all for attending.